Guess I want to start, Lauren, by asking, we obviously saw a more serious point of action from lawmakers last week, real funding, real attention. There's a bit of a disconnect, of course, coming in terms of the messaging around how serious this is and what Americans should do about it, and some concern that it's being downplayed by the White House. What's your take on how well prepared Americans are for this?
I think in general, America is well prepared to respond to pandemics and pandemic threats. I think the challenge here has been the testing issue, which has sort of undermined our ability to be more prepared for this specific outbreak and this specific potential pandemic. We don't have a great understanding of what the cases of COVID-19 look like in the United States right now. And so that has really challenged our ability to further our preparedness efforts.
One of the concerns, of course, is simply overwhelming the system in terms of kind of the healthcare workers, number of hospitals. We have that same issue in Canada if this becomes a kind of a worst case scenario. What can be done on that front? There's money being set aside, but not for those kind of more systemic issues of kind of just basic supply and demand in the healthcare system.
Yeah, absolutely. Our healthcare system is strained on a daily basis, and we have learned a lot of lessons from both pandemic and seasonal influenza that we're going to be applying should these influx of patients come in. We are looking at our surge capacity plans, so where will we put sicker patients? How will we move patients through the system? Hospitals across the country are adapting their pandemic flu plans for this outbreak, and they're really trying to strategize how can we best manage these patients together. Should we cohort them? Should we keep them isolated? And what does that look like when we have large volumes of patients versus a few in various counties across the United States?
Lauren, I think some of the hysteria around coronavirus has come from the fact that, frankly, we're not doing a good enough job of separating out mortality rates relative to the flu in different age groups and those with pre-existing conditions. Walk us through those mortality rates for those 70 plus with pre-existing conditions, how those relate to the flu, and then, frankly, the survival rates of the healthy and younger population.
Yeah, it's a great question, and I think the comparison to flu is really important because the difference between flu and this coronavirus is that with flu, we have other mitigation strategies. We have plans in place, we have therapeutics, we have vaccines. The case fatality rate is higher than flu across the board, particularly in this older, more vulnerable population. I think it's hovering at about 2% right now. But it's important to note that that case fatality rate or that mortality rate is not including a lot of the mild cases. So I don't have the exact breakdowns in front of me right now, but when you think about that overall case fatality rate, remember that people who with mild illness, especially kids, are not getting tested because they're not making their way to hospitals. All of our data right now are really focused primarily on the people who make it to hospitals. So the people who are really sick and end up in the emergency department and then go to the ICU or even just the floor. And then our travel population, the population that we're looking at across the rest of the globe outside of China and places like Italy, those are people who were well enough to travel. So there is a little bit of a bias there as well. So in general, I would say we have a lot more learning to do about what the morbidity and mortality of this outbreak looks like.
In the midst of the learning curve that we are all on, do we expect this to be similar to the flu, where you get a seasonal drop-off rate as the weather warms up?
I think that's what everyone is hoping for. We have seen some drop-off already in places like China, and that may be seasonality. It may be some of their isolation strategies are working. There is seasonality in other coronaviruses, not all of them, but some of them, and I think everyone's looking to see what happens in the spring.
Our thank you to Lauren Sauer of Johns Hopkins, and a reminder that the Bloomberg School of Public Health is supported by Michael Bloomberg, founder of Bloomberg LP and Bloomberg Philanthropies.